101. Hypothyroidism can cause cold intolerance. True or false? Answer: true. Rationale: hypothyroidism reduces metabolic rate, impairing heat production and causing cold intolerance, requiring thyroid hormone replacement to restore thermoregulation. 102. Type 1 diabetes is managed primarily with lifestyle changes. True or false? Answer: false. Rationale: type 1 diabetes requires insulin therapy due to absolute insulin deficiency, with lifestyle changes as an adjunct, ensuring effective glycemic control and safety. 103. Hyperthyroidism can cause diarrhea. True or false? Answer: true. Rationale: hyperthyroidism accelerates gastrointestinal motility due to increased metabolism, causing diarrhea, requiring antithyroid therapy to normalize bowel function. 104. Glucagon should be administered to a patient with a blood glucose of 300 mg per deciliter. True or false? Answer: false. Rationale: glucagon is used for hypoglycemia, not hyperglycemia, which requires insulin to lower blood glucose and prevent complications like ketoacidosis. 105. Adrenal crisis can cause hypernatremia. True or false? Answer: false. Rationale: adrenal crisis causes hyponatremia due to aldosterone deficiency, leading to sodium loss, requiring hydrocortisone and fluids to restore electrolyte balance. 106. Hemoglobin A1c is used to diagnose acute hypoglycemia. True or false? Answer: false. Rationale: hemoglobin A1c monitors long-term glucose control, not acute hypoglycemia, which requires immediate blood glucose testing and carbohydrate administration. 107. Hyperparathyroidism can cause bone pain. True or false? Answer: true. Rationale: hyperparathyroidism increases bone resorption due to elevated parathyroid hormone, causing bone pain, requiring calcium management to prevent skeletal damage. 108. Insulin is contraindicated in patients with type 2 diabetes. True or false? Answer: false. Rationale: insulin is used in type 2 diabetes when oral medications fail, helping control hyperglycemia and prevent complications, tailored to individual patient needs. 109. Cushing syndrome can cause hypokalemia. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome promotes potassium excretion, causing hypokalemia, requiring monitoring to prevent muscle weakness and cardiac issues. 110. Diabetes insipidus is associated with low urine output. True or false? Answer: false. Rationale: diabetes insipidus causes high urine output due to antidiuretic hormone deficiency, requiring desmopressin to reduce water loss and prevent dehydration. 111. Methimazole is used to treat thyroid storm. True or false? Answer: true. Rationale: methimazole inhibits thyroid hormone synthesis, a critical intervention in thyroid storm to reduce metabolic rate and stabilize life-threatening symptoms. 112. Diabetic ketoacidosis is treated with oral glucose. True or false? Answer: false. Rationale: diabetic ketoacidosis requires intravenous insulin and fluids to correct hyperglycemia and acidosis, not oral glucose, which would worsen the condition. 113. Pheochromocytoma can cause palpitations. True or false? Answer: true. Rationale: catecholamine excess in pheochromocytoma causes palpitations due to sympathetic overstimulation, requiring alpha blockers and surgical management for control. 114. Hypoglycemia can cause confusion in diabetic patients. True or false? Answer: true. Rationale: hypoglycemia impairs brain glucose supply, causing confusion, requiring rapid carbohydrate administration to restore neurological function and ensure safety. 115. The thyroid gland secretes growth hormone. True or false? Answer: false. Rationale: the thyroid gland secretes thyroid hormone, while growth hormone is secreted by the pituitary gland, a distinction critical for endocrine disorder management. 116. Hyperaldosteronism can cause edema. True or false? Answer: true. Rationale: hyperaldosteronism increases sodium retention, leading to fluid accumulation and edema, requiring aldosterone antagonists to manage fluid balance. 117. Type 2 diabetes can be reversed with weight loss in some cases. True or false? Answer: true. Rationale: weight loss improves insulin sensitivity in type 2 diabetes, potentially reversing early disease, emphasizing lifestyle interventions for glycemic control. 118. Myxedema coma can cause hypertension. True or false? Answer: false. Rationale: myxedema coma, a hypothyroidism emergency, causes hypotension due to reduced metabolism, requiring levothyroxine and supportive care to stabilize hemodynamics. 119. Hyperthyroidism can cause hair thinning. True or false? Answer: true. Rationale: hyperthyroidism disrupts hair growth cycles due to increased metabolism, causing thinning, requiring antithyroid therapy to restore endocrine balance and hair health. 120. Glucagon is secreted by pancreatic beta cells. True or false? Answer: false. Rationale: glucagon is secreted by pancreatic alpha cells to raise blood glucose, while beta cells secrete insulin, critical for understanding glucose regulation. 121. Diabetic neuropathy can cause foot ulcers. True or false? Answer: true. Rationale: diabetic neuropathy reduces sensation, increasing injury risk and causing foot ulcers, requiring meticulous foot care to prevent infection and amputation. 122. Desmopressin is used to treat diabetic ketoacidosis. True or false? Answer: false. Rationale: desmopressin treats diabetes insipidus, while diabetic ketoacidosis requires insulin and fluids to correct hyperglycemia and acidosis, not desmopressin. 123. Hypoparathyroidism can cause muscle cramps. True or false? Answer: true. Rationale: hypoparathyroidism causes hypocalcemia, leading to muscle cramps, requiring calcium and vitamin D supplementation to prevent neurological complications. 124. Blood glucose monitoring is critical for type 1 diabetes management. True or false? Answer: true. Rationale: frequent blood glucose monitoring guides insulin dosing in type 1 diabetes, preventing hypo and hyperglycemia to ensure long-term patient safety. 125. Thyroid storm is a complication of hypothyroidism. True or false? Answer: false. Rationale: thyroid storm is a life-threatening complication of hyperthyroidism, not hypothyroidism, requiring urgent antithyroid drugs and beta blockers for stabilization. 126. Acromegaly can cause vision changes. True or false? Answer: true. Rationale: acromegale's pituitary tumor can compress the optic chiasm, causing vision changes, requiring imaging and treatment to prevent permanent visual loss. 127. Insulin should be shaken vigorously before administration. True or false? Answer: false. Rationale: insulin should be gently rolled, not shaken, to avoid denaturing, ensuring potency and effective glycemic control for diabetes management. 128. Addison's disease can cause hyponatremia. True or false? Answer: true. Rationale: Addison's disease reduces aldosterone, causing sodium loss and hyponatremia, requiring glucocorticoid and mineralocorticoid replacement for electrolyte balance. 129. Patients with diabetes insipidus require high-sodium diets. True or false? Answer: false. Rationale: diabetes insipidus requires adequate hydration, not high-sodium diets, to compensate for water loss and prevent hypernatremia-related complications. 130. Propylthiouracil can cause liver toxicity as a side effect. True or false? Answer: true. Rationale: propylthiouracil, used for hyperthyroidism, can cause liver toxicity, requiring regular liver function monitoring to ensure patient safety during treatment. 131. Diabetic retinopathy can be prevented with tight glucose control. True or false? Answer: true. Rationale: tight glucose control reduces retinal damage risk in diabetic retinopathy, emphasizing early intervention and regular eye exams to protect vision. 132. the adrenal gland secretes thyroid hormone. True or false? Answer: false. Rationale: the adrenal gland secretes cortisol and catecholamines, while thyroid hormone is secreted by the thyroid gland, critical for accurate endocrine management. 133. Hypothyroidism can cause dry skin. True or false? Answer: true. Rationale: hypothyroidism reduces sweat and oil production, causing dry skin, requiring thyroid hormone replacement to restore skin integrity and patient comfort. 134. Administering insulin to a patient with a blood glucose of 70 mg per deciliter is appropriate. True or false? Answer: false. Rationale: a blood glucose of 70 mg per deciliter is normal or near hypoglycemic, requiring monitoring or carbohydrates, not insulin, to prevent dangerous glucose drops. 135. Prolactinomas can cause galactorrhea in men. True or false? Answer: true. Rationale: excess prolactin from prolactinomas can cause galactorrhea in men, requiring dopamine agonists to reduce prolactin and restore hormonal balance. 136. Hyperglycemia can cause fatigue in diabetic patients. True or false? Answer: true. Rationale: hyperglycemia impairs cellular energy use, causing fatigue, requiring insulin or oral agents to control glucose and improve patient energy levels. 137. Hypophysectomy can cause hypothyroidism. True or false? Answer: true. Rationale: hypophysectomy removes the pituitary, reducing thyroid-stimulating hormone and causing hypothyroidism, requiring levothyroxine to maintain thyroid function. 138. Type 1 diabetes is caused by insulin resistance. True or false? Answer: false. Rationale: type 1 diabetes results from autoimmune beta cell destruction, not insulin resistance, requiring insulin therapy, unlike type 2 diabetes management. 139. Hyperparathyroidism can cause constipation. True or false? Answer: true. Rationale: hyperparathyroidism causes hypercalcemia, slowing gastrointestinal motility and causing constipation, requiring calcium management for symptom relief. 140. Cushing syndrome can cause weight loss. True or false? Answer: false. Rationale: Cushing syndrome causes weight gain due to cortisol excess, promoting fat deposition, requiring cortisol-lowering therapies to manage obesity risks. 141. Levothyroxine should be taken at bedtime for optimal efficacy. True or false? Answer: true. Rationale: taking levothyroxine at bedtime, away from food, enhances absorption, ensuring effective thyroid hormone replacement and optimal endocrine function. 142. Diabetic ketoacidosis can cause hyperkalemia initially. True or false? Answer: true. Rationale: diabetic ketoacidosis causes initial hyperkalemia due to acidosis shifting potassium extracellularly, requiring careful monitoring during insulin therapy. 143. Adrenal crisis can cause fever. True or false? Answer: false. Rationale: adrenal crisis causes hypothermia due to cortisol deficiency, not fever, requiring hydrocortisone to restore metabolic function and stabilize temperature. 144. A random blood glucose of 200 mg per deciliter with symptoms confirms diabetes mellitus. True or false? Answer: true. Rationale: a random blood glucose of 200 mg per deciliter with symptoms like polyuria confirms diabetes, guiding immediate management to prevent endocrine complications. 145. Hyperthyroidism can cause muscle weakness. True or false? Answer: true. Rationale: hyperthyroidism causes muscle catabolism due to increased metabolism, leading to weakness, requiring antithyroid therapy to restore muscle strength. 146. Patients with diabetes insipidus have high urine osmolality. True or false? Answer: false. Rationale: diabetes insipidus causes low urine osmolality due to dilute urine from water loss, requiring desmopressin to concentrate urine and prevent dehydration. 147. Type 2 diabetes can cause diabetic ketoacidosis. True or false? Answer: true. Rationale. Though rare, type 2 diabetes can cause diabetic ketoacidosis in severe stress or illness, requiring insulin and fluids to correct acidosis and ensure stability. 148. Hypothyroidism can cause menstrual irregularities. True or false? Answer: true. Rationale. Hypothyroidism disrupts reproductive hormones, causing menstrual irregularities, requiring thyroid hormone replacement to restore normal cycles. 149. Administering desmopressin can cause fluid overload. True or false? Answer: true. Rationale. Desmopressin increases water retention, risking fluid overload, requiring careful monitoring to ensure fluid balance and cardiovascular safety in treatment. 150. Cushing's syndrome can cause diabetes mellitus. True or false? Answer: true. Rationale. Excess cortisol in Cushing's syndrome impairs glucose metabolism, causing diabetes mellitus, requiring glucose monitoring and cortisol-lowering therapies.